Employment Medical Scheme says it's ready to support government in ensuring the COVID-19 vaccine reaches a broader number of its members and dependents. GEMS says it's committed to paying for the approved vaccine for a large number of its frontline workers. For more on this, I'm joined by the Medical Scheme's Principal Officer, Dr. Stan Moloabi. Thank you very much, Mr. Moloabi, for your time here on eNCA. Now, of course, how exactly will it work once the 1.5 million vaccines have arrived here? What will GEMS be doing to make sure that the vaccines arrive to the people that it's intended for?
Good morning, Maseho, and good morning to the viewers. What basically is happening, as you may be aware, the government has taken the lead in ensuring that there is firstly procurement of a vaccine. But in terms of what we will be doing, we are a funder of the government employees, and based on the rollout strategy that has been announced by the Minister of Health, our members who are employees of government will obviously be allocated vaccine in line with the rollout strategy that has been announced by the Minister. So in terms of what we will be doing is to ensure that there is funding for our members.
Now, of course, some of the, for instance, the prescribed minimum benefits in medical aid schemes are different. But now that this is coming through, what are the cost implications?
Well, the cost implications are really based on the fact that we are required as medical schemes, and this applies to all medical schemes. We are required to fund vaccine as a PMB, which means that the cost will have to be covered for each vaccine that any member of a medical schemes receives. So the implications are basically that we will have to cover the entire cost of the vaccine as our members receive these vaccines.
Now, I don't know if you'll be able to answer this question. I know that GEMS is not really involved in the procurement of the vaccines, but you will be involved in the rollout and distribution of the vaccines, and this will be a mass rollout, about 1.9 million healthcare workers that you are expecting to distribute the vaccines to. How is GEMS going to make sure that there is no corruption, or that the vaccine actually gets to the people that it's intended for?
Well, I cannot guarantee the question that you say that there's no corruption, but I think what is important is that when we commit to ensuring that we pay for any service that we have a responsibility as a medical scheme that to ensure that that money we pay is for the service that we are procuring on behalf of our members. So how we normally do it, we pay for a service once it is rendered. And that gives some assurance that we are paying for a service that has been rendered. And another thing is that medical scheme, what we pay for as medical schemes is usually based on tariffs that are predetermined. And these tariffs are really benchmark to ensure that there's value for money for the services that you receive. So that is the protection that we have against any, corruption that can happen. So we were quite convinced that there shouldn't be any form of corruption in what we will be paying for.
And GEMS is also reaffirming quite a couple of times that it's ready by the time these vaccines arrive. It will be the end of February, according to the health minister. What makes you think that you're ready for such a huge rollout?
Well, from a funding perspective, really, we have been ready since last year because we had planned for this. We have budgeted for this in our finances. So the readiness is largely from the fact that we're saying whenever the rollout starts, we will be able to pay in terms of our systems to pay for the vaccines. In terms of our involvement in the actual rollout, it is to the extent that we are in communication and in engagements, firstly with the regulator and then with the Department of Health as the planning continues about the rollout. So our readiness is largely from the funding perspectives, but we are also involved in the current planning.
All right, thank you very much for your time. That was Dr. Stan Moloabi from the Government Employees Medical Scheme.